although he says I'm not anti-vaccine, it's hard to believe what he says because he has said many things that are untrue before.
Now, the Senate second confirmation hearing for Robert F. Kennedy Jr. is taking place in Washington today. He's Donald Trump's pick for health secretary. When he spoke to the Finance Committee yesterday, a protester interrupted him.
I want to make sure the committee is clear about a few things. News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
We'll have order.
The Democrat Senator Ron Wyden made his thoughts about RFK Jr.'s vaccine stance pretty clear.
He has made it his life's work to sow doubt and discourage parents from getting their kids life-saving vaccines. It has been lucrative for him and put him on the verge of immense power. This is the profile of someone who chases money and influence wherever they lead, even if that may mean the tragic deaths of children and other vulnerable people.
Some Republicans, like Senator Ron Johnson of Wisconsin, praise Kennedy's work on eradicating chronic disease in children.
Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. My first response was, Bobby, this is an answer to my prayers.
RFK Jr. was also asked about his views on abortion.
Did you say on a podcast, and I quote, "I wouldn't leave abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy?
Today, he'll be up before the Health, Education, Labour and Pensions Committee. Dr Thomas Freidan is the former director of the Centers for Disease Control and Prevention under Barack Obama and now CEO of Resolve to Save Lives, a public health-focused non-profit, and he joins me now. Good afternoon.
Good afternoon.
So we heard there in those clips quite a lot of contestation, I think it's fair to say, about whether or not RFK supports abortion, supports vaccines. What do you think about those various claims? Can you just talk us through them?
Well, first, it's very clear that for at least a decade, RFK Jr. has been one of the leading forces spreading misinformation about vaccines. And although he says I'm not anti-vaccine, it's hard to believe what he says because he has said many things that are untrue before, and he has specifically denied saying things that he's on tape as having said. So it's hard to believe him when he says that. And even if you look at exactly what he said yesterday, one of the things he said is that 97% of the members of a very important committee called ACIP are conflicted, had conflicts of interest. That's wrong. It's a lie. And not only is it a lie, it's a lie that undermines confidence in vaccine policy in the U.S. So on one hand, he's saying he's not anti-vaccine. On the other hand, he's doing things that are undermining vaccine confidence, vaccine safety, and child health.
And on abortion rights, something that he was also not massively clear on. Can you just explain what happened yesterday? What do you think his position on that will be? Because clearly it's already banned in 12 US states and people are asking what impact he might have on abortion rights more widely in the US.
It's very clear that this will be a policy that is set above his level at the White House and in Congress and in states. It's also something that is highly controversial and an area where it's best to be focused on what are the rights of individuals. It's very interesting to say that some parts of political parties don't want government in anyone's business except for this issue. So it's a very conflictual issue, one that divides Americans and one that is really creating major problems for women in pregnancy who may make a decision to end that pregnancy.
And on some of the basic facts about the US healthcare system, there was a suggestion that he confused Medicare and Medicaid yesterday, having basically impeccable credentials on the understanding of the US healthcare system. Do you think he understands how it works?
Well, in fairness, Medicare and Medicaid are very complicated. I think the broader challenge and one of the interesting issues that the hearings are bringing up is the issue of chronic disease. And here again, there is some kernel of truth to what he's saying, that yes, we have a big chronic disease problem. Yes, we need to get conflicts of interest out of the decision-making process. But for many of the chronic diseases, we know what the problems are. It's the selling of sugary, salty food to Americans. And currently, the Food and Drug Administration of the US has a proposal, a regulatory proposal, to require companies to put warnings on foods that are high in salt and sugar. That is under the control of the Secretary of Health and Human Services. So I'd really like to hear Congress ask him whether he will support that, even if industry challenges ensues. I'd really like to hear Congress ask him about his assertion that 97% of people who voluntarily work on immunization policy to make sure our kids are safe are conflicted. These are lies and they're harmful.
And I mean, on that question of sugar and obesity, you seem to obviously have a lot of skepticism, but there is perhaps some hope that he might well be able to do something on this. Is there anything else where you think actually he might be able to have a positive impact if he's approved?
Well, I think chronic disease, it's very encouraging to hear Republicans and Democrats talking about the need to address chronic disease, but it's not a complete mystery. There's a lot that we know about what's causing chronic disease. Tobacco use, too much sugar, alcohol, insufficient physical activity, particulate matter, soot, PM 2.5, all of these things cause chronic disease. And for that matter, we know how to prevent some cancers, from liver cancer, cervical cancer, with vaccines. One of those vaccines, RFK Jr, is suing the company that makes it. So yes, there are some chronic diseases that we don't understand and need to do better about. We need to reverse the obesity epidemic, and there are sensible policies that may be able to do that, including that FDA policy on front-of-pack warnings.
And yeah, just finally on that wider point and reflecting on your time at the CDC, what do you think the health issues are that are the biggest threat to Americans right now?
Well, there are several. One of them is the increase in chronic diseases and the need to improve our primary healthcare system and the need to improve the way that we regulate tobacco in particular, because this remains the leading preventable cause of death. A second major area is our need to continue engaging with the world. The U.S. is not isolated from disease trends, whether that's new avian influenza or COVID or the next pandemic. And so walking away from the World Health Organization, defunding global health organizations, isn't just bad for the world, it makes America less safe.
And just very quickly on whether or not you expect RFK to actually go through, we've seen potential speculation that Susan Collins of Maine, Lisa Murkowski, these kind of centre-ish figures might well move to block him. What do you think?
We'll have to see. We'll see what happens today and in the coming days.
We indeed will. Well, thank you very much for joining us and talking us through that. That was Dr. Thomas Freidan, former director of the Centers for Disease Control and Prevention, the CDC, under Barack Obama.